during Viva. These are the types of bone. What is the type of that particular bone, whether it is a long bone, short bone, irregular bone, likewise. Its site determination and anatomical positions, particularly in the upper limb. Anatomical position of the humerus is important. General features includes parts of the bones, various borders and surfaces, articulation of that particular bone, and joint formed by that bone, and the important attachments. So the bones of the upper limb includes clavicle, which forms the shoulder girdle, humerus, radius ulna, and articulated hand. Right? You have already learned the revision class of bones of the lower limb. So for the clavicle, particularly important is the peculiarity of the clavicle. Yeah, that is very, very important. Then it's site determination. And once you determine site correctly, then the parts of the bone, particular clavicle, its articulation, joints formed by the clavicle, the type and subtype of the particular joint. So here you can see the articulation of the clavicle. If you see medially, it articulates with the sternum to form the sternoclavicular joint. And laterally it articulates with the acromion process of the scapula. So forming the acromioclavicular joint. So these are the two joints of the shoulder girdle. So which type of joint these are? Sternoclavicular joint is of which type? Anyone? What is the type of the sternoclavicular joint? किस टाइप का जॉइंट है वो? Plain, saddle. Of course, it's a synovial joint, but no, it's not a primary cartilaginous joint. It's a synovial joint. It's a saddle variety of synovial joint. Right. So sternoclavicular joint is the saddle variety. Which movement takes place at this joint? Saddle joint is a multi-axial joint, right? So which are the movements takes place at this joint? Is for example in the shoulder joint, it's a multi-axial joint. So the flexion, extension, adduction, abduction, medial and lateral rotation or circumduction. This movement takes place at the shoulder joint. So the which are the movements takes place at this joint, at sternoclavicular joint? How the rotation takes place at this joint? Conjoint rotation. Somebody 108 has written. Yes. And the movements of the scapula takes place at the sternoclavicular joint as well as at the acromioclavicular joint. This includes elevation, depression, protraction, retraction, forward rotation. These are the movements takes place at the sternoclavicular joint. तो ये आपको वाइवा में पूछते हैं, है ना? आपने पढ़ा होगा फिर भी आप आंसर नहीं कर पाओगे. Then laterally acromioclavicular joint. Okay. So I will not go in detail of each bone, but I will tell you the important questions and important area of that particular bone of the upper limb. Okay. Now here you can see the parts of the bone. The clavicle is having a lateral end, medial end, and the intermediate shaft. And the shaft is divided according to the curvature into the medial. Okay, if you see the medial two-third curvature of the medial two-third is convex anteriorly, and the lateral one-third is concave anteriorly. Now there are certain impressions on the under surface. By remembering that impressions, you can determine the site of the clavicle. If first you have to differentiate lateral end from the medial end of the clavicle, and then see the under surface or the inferior surface of the clavicle. On the lateral side, there is a conoid tubercle. Rounded tubercle is there, which is called the conoid tubercle. And extending from the conoid tubercle laterally, there is one ridge, that is trapezoid ridge. So keep it on the inferior, the under surface or in the inferior surface. As well as on the medial side, there is an oval impressions. Both this part, these three structures gives the attachments of which ligament? This conoid tubercle and trapezoid ridge gives the attachment of which ligament? Yes, the two different parts of the coracoclavicular ligament extending from the coracoid process of scapula to the clavicle. And medially, these oval impressions gives the attachments of costoclavicular ligament extending from the first costal cartilage to the clavicle. Right. All attachments on the clavicle includes the joint capsules of both the joint. Muscles, particularly you have to remember for the attachments of the muscles over the clavicle are the deltoid attachments of deltoid, trapezius, pectoralis major on the subclavian groove, subclavius, sternohyoid, and sternocleidomastoid, clavicular head of the sternocleidomastoid. So here you can see the attachments of deltoid. Attached on the anterior border of the lateral one-third. This is the deltoid. On the posterior border of the lateral one-third, there is trapezius. Again, on the anterior surface of the medial two-third, origin of pectoralis major. On the upper surface, clavicular head of the sternocleidomastoid, there is sternohyoid. And on the subclavian groove, subclavius muscle. And the ligaments, coracoclavicular and costoclavicular ligament. Now the relations of the inferior surface of the clavicle with the important neurovascular structures. This includes subclavian vessels, subclavian artery and vein, and the brachial plexus. So this was about the clavicle. And of course, you have to remember the peculiarity of the clavicle. Now next one is the scapula. So what's important about the scapula? First of all, it's a flat bone type of the bone. Its position is lies on heart. It is triangular bone having two surface, ventral and dorsal surface. Three borders, medial, lateral and superior border. Three angles, superior, inferior and lateral angle. And three processes, coracoid process, acromion process and spinous process. And its articulation. See, articulation of clavicle and scapula is very, very important. Most of the student facing the difficulty in the articulation between the clavicle and scapula. So you have to remember the particular portion of the clavicle articulates with the which to the figure. See here you can see the ventral surface, this is the anterior surface, and this is the back side or the posterior aspects of the scapula. Right? Now the three borders. See, this is the upper border or superior border. And which is this notch? What is the name of this notch? इस नोच का नाम क्या है यहाँ पे? Suprascapular notch, right? So one ligament, that is suprascapular ligament, which converts this notch into the foramen, right? Suprascapular foramen. So this is the superior border. Then this one is the medial border, and this is the lateral border. Out of the three border, if you see, the lateral border is the thickest one. Border. Why it is thickest? You know the reason behind it. Why the lateral border is the thickest one? Anybody? It's a ridge like, not a border. Protection for what? किसको protection provide करता है? Attachments of many muscle. तो if you compare it with the medial border पे तो attachments ज़्यादा है as compared to the lateral border. Lateral border पे कौन से attachments होते हैं? Can you name any muscle, any one muscle? Yes, teres minor and major. So the medial border पे if you see on the dorsal aspect there are three muscle, rhomboides minor and major, and on the ventral aspects, which muscle attach on the ventral aspects of medial border? Anybody? On the ventral aspects of the medial border, not the surface. Yes, serratus anterior. है ना? And what is the axon of serratus anterior? Main axon. There are different digitations, like around the 8 digitations of the serratus anterior. The punching movements and along with the trapezius, upper and lower fibers of the trapezius, it will help in the overhead abduction of the upper limb or at the shoulder joint, right? So, what is the reason for this lateral border? Now, during overhead abduction, if you see in the overhead abduction, the lower 5 digitations of the serratus anterior is inserted on the inferior angle, right, on the inferior angle of the scapula. And this during overhead abduction, there is a forward rotation of the inferior angle of the scapula, forward and upward rotation, so that the glenoid cavity turns upward, right? And during this action in the overhead abduction, border act as an axis around which the forward rotation of the inferior angle takes place by the serratus anterior, and that's why this border is the thickest border. It acts as an axis during the overhead abduction or during the pull of the serratus anterior of the inferior angle, right? And that's why this border is the thickest border. This lateral border is act as an axis. So the features on the ventral aspects, one of them is the superior border, then medial, and then lateral border. Now three processes. This is the coracoid process, and posteriorly this one is the spinous process, and that become continuous anteriorly with the acromion process. Now three angle, superior angle, inferior angle, and the lateral angle is the humerus to form the shoulder joint. Now the two surfaces, see, this is the costal surface or the ventral surface, and there are so many oblique ridge which indicates the attachments of the muscle, that is subscapularis over here, and it is a multi-pinate muscle having so many tendon, and this tendon will produce the impressions on the coastal surface. And on the dorsal surface, spinous process will divide into two fossa. So these are the features, general features of this scapula. Now the important attachments, there are so many attachments on the scapula, which includes the muscles of shoulder region as well as muscles of scapular region. The coracoid process is which type of epiphysis? What is the type of epiphysis of the coracoid process? Yes, it's an atavistic epiphysis. So the attachments on the both the surface include subscapularis, supraspinatus, and infraspinatus. Then the attachments on the coracoid process, the three muscles, origin of coracobrachialis and sorted of biceps brachii, sorry, and the insertion of pectoralis minor. From the supraglenoid tubercle, origin of long head of biceps. From the infraglenoid tubercle, origin of long head of triceps. Then the attachments on the spinous process and the acromion process includes deltoid and trapezius, teres minor, teres major, on the medial border, three muscles, and attachments of serratus anterior. Attached on the scapula includes coracoacromial ligament. On the coracoid process, there are coracohumeral and coracoclavicular ligament. Suprascapular ligament, which bridge the suprascapular notch. Spinoglenoid ligament. So this was about the scapula. Now the humerus. Anatomical parts of the humerus includes upper and lower and ends activities of the long bone. Um, Now for the upper end, there is a head, neck. There are three type of necks seen in the humerus. These are the anatomical neck, surgical neck. Which one is third? Third कौन सा आएगा? Humerus में. One of them is the anatomical neck, then surgical neck, morphological neck. What is it? What is morphological neck? It indicates the line of fusion of the epiphysis, epiphyseal line. Right. So surgical neck is the line which separates the whole upper end from the shaft, and anatomical neck is only separates the head from the rest of the upper end. Then the articulation and the joints formed by the humerus. Here you can see the articulation of the clavicle, scapula, and the upper end of humerus. See the lateral end of the clavicle articulates with the acromion process of the scapula and forms the acromion clavicular joint. And the formation of the shoulder joint. Right. Now the parts of the upper end is having head, greater tubercle, lesser tubercle, anatomical neck, and surgical neck. Surgical neck, the structures which winds around the surgical neck posteriorly. This includes axillary nerve and posterior circumflex vessels. Then the in between two tubercle, greater and the lesser tubercle, there is bicipital groove or the intertubercular sulcus. Borders and surface includes medial border, anterior border, and the lateral border. If you see the medial and lateral border, it become more prominent in the inferior aspect. It is ill-defined in the upper aspect, right? And then rounded anterior border. This is the posterior surface. And a surface is includes anteromedial surface and the anterolateral surface. and the posterior surface. Features of the lower end. Two epicondyle, medial and epicondyle. Which now posterior aspect, ulnar nerve. Here in the lower end, medial and lateral epicondyle. But in the femur, if you see lower end, there are two condyles. Hello, am I audible? Okay, so what is the difference between epicondyle and condyle? Anybody? Epicondyle is at upper part of condyle. What is the difference between epicondyle and condyle? जैसे यहाँ पे लोअर एंड ऑफ ह्यूमरस में तो कॉन्डाइल है ही नहीं. Difference in articulation. Can you explain how what is the difference in articulation? Yes, condyle is the articular part. It articulates with the other bone, and epicondyle is the non-articular part. So that's the difference between epicondyle and condyle, right? So the medial epicondyle and the lateral epicondyle. Then there are two articular areas like proclea and capitulum. Proclea articulates with the ulna and capitulum articulates with the head of radius. Then this is the olecranon fossa. These are the parts of the lower end of the humerus. So the attachments on the humerus includes capsule of the shoulder joint, capsule of elbow joint surrounds the articular margin. Then the three important nerves directly related with the humerus. One which winds around the surgical neck of humerus, that is axillary nerve. One lies in the radial groove, that is radial nerve, or in the spiral groove. And behind the medial epicondyle, that is ulnar nerve. Then what are the contents of bicipital groove? What are the contents of bicipital groove or the intercondylar, intertubercular sulcus? Contents of bicipital groove. Yes, tendon of biceps brachii. Then no, the see there is a difference between the contents and attachments on the bicipital groove. Contents are not attached with the groove; it just passes through the groove. And the three muscles attached to the bicipital groove. One of them is the latissimus dorsi. So the contents includes tendon of the biceps brachii and ascending branch of the anterior circumflex femoral vessels. Okay. Now these are the muscles attached to the humerus. List of the muscles attached on the humerus, like on the greater tubercle, there are three muscles: supraspinatus, infraspinatus, and teres minor. On the lesser tubercle, insertion of subscapularis. Then in the bicipital major and dorsi. Medial border coracobrachialis and inferior of the anterolateral and anteromedial surface brachialis. Then the two on the posterior surface, lateral and medial head of the triceps. Insertion of deltoid on the deltoid tuberosity in the lower aspects of the lateral supracondylar line. Brachioradialis and extensor carpi radialis longus. Then common origin of flexor superficial muscles and superficial extensor muscles. Then the radius, just like the other long bone, the parts includes the upper end, lower end, and the shaft of the radius. The important thing is the joints formed by the radius. Just like that, ulna See here the features of the upper end of the radius and ulna. See on the ulna there is a olecranon process, anteriorly coronoid process, and trochlear notch. Right. Then laterally there is radial notch which articulates with the head of the radius. On the upper part of the radius, head of the radius, neck of the radius, and radial tuberosity. Again, you can see the features of the upper end of the ulna, having an olecranon process, trochlear notch, coronoid process, and radial notch. Now here you can see the attachments of the annular ligament of the head of the radius, as well as the attachments of the oblique cord. Right, annular ligaments winds around the upper part of the head of the radius and is attached to the radial notch of the ulna. Just like that, there is attachments of the oblique cord. Then the attachments of the interosseous membrane between the radius and the ulna. Then the articulation of the lower end, see the formation of the elbow joint, both the upper end of radius as well as upper end of ulna takes part in the formation of the elbow joint. Right, it articulates with the trochlea and the head of the radius. Then the types of the superior radioulnar joint. Which type of joint it is? Superior radioulnar joint. There are three radioulnar joints, right? Superior, middle, and the inferior radioulnar joint. So what is the type of the superior radioulnar joint? Pivot variety of synovial joint. Then the middle radioulnar joint. Syndesmosis type. And the inferior? So here you can see the three radioulnar joint. Then the borders of the radius and ulna, both are having a anterior border, posterior border, and interosseous border. Right? And there lies surfaces between the borders. Features of the lower end of the radius, if you see in the lower end, on the anterior surface, see in the dorsal surface there is a dorsal tubercle of Lister. And there are so many grooves for the tendon of the muscles of the extensor compartment. And this is the lower end of the anterior surface of the lower end of the radius. On the inferior surface, if you see, there are it articulates with the two carpal bones, which includes scaphoid and unit. So the two articular surfaces on the inferior aspect of the radius. Then the both are having on the radius there is radial styloid process. Right? Now these are the list of the muscles attached on the radius. See, there are so many muscles attached on the radius as well as ulna. The important one is the attachments of biceps brachii, where it inserted in the radius. Radius में कहाँ पे होता है उसका insertion? Biceps brachii का. On the radial tuberosity, right? So, and on the lateral surface of the radius, above downward, there are attachments of three muscles: supinator, pronator teres, and brachioradialis. Then on the posterior surface, flexor pollicis longus. In the lower aspects of the anterior surface, pronator quadratus. And the two ligaments, quadrate ligaments and oblique cord. And the attachments of the articular disc of the inferior radioulnar joint. Then on the ulna, the attachments of interosseous membrane, capsule of elbow joint, annular ligament, like the important one is the initial group of the flexor muscles. Yeah, common origin from the medial epicondyle of the humerus. This is the flexor. This is the pronator teres inserted on the so the superficial group of the muscles and its attachment flexor carpi radialis, palmaris longus and flexor carpi ulnaris. Then these are the deep group of muscle, flexor rigitorum profundus, flexor pollicis longus and pronator quadratus. Now the articulated hand. So first of all, identification of the bones forming the articulated hand. है ना आपको आइडेंटिफाई करना आना चाहिए सारे bones and joints between the bones. There are 8 carpals, 5 metacarpals, and 14 phalanges. So carpals are arranged in the 2 rows, proximal rows, 4 bones. In the distal rows, there are 4 bones. From lateral to medial in proximal row, scaphoid, trilateral, and pisiform. Pisiform. So it's a sesamoid bone. Develops in the tendon of the flexor carpi ulnaris. Then on the distal row, there are trapezium, trapezoid, capitate, and hamate. Trapezoid. Capitate is the largest carpal bone, and the hamate. Hamate has a hook on the hamate. Then the metacarpals are numbered from lateral to medial, first, second, third, and fourth, and fifth metacarpals. The parts of the metacarpals are the head, shaft, and base of the metacarpals. And here you have to remember the difference between the metacarpals and metatarsals, right? Then there are 14 phalanges. Of the medial 4 fingers are having 3 phalanges, proximal, middle, and the distal phalanx. Thumb has only 2 phalanges, proximal and distal phalanges. Now the joints formed by the bones of the hands, articulated hand. The important joints are the carpo-metacarpal joints. See the joints between the base of the metacarpals and the carpal bone. So what is the type of the first carpo-metacarpal joint? Which type of joint it is? First carpo-metacarpal joint. Hinge or saddle? It's a saddle variety of synovial joint, right? And the joints between the metacarpal and the phalanges. So this is the metacarpophalangeal joints, and it is of the ellipsoid variety of synovial joint, and the proximal and distal interphalangeal joint. These are of the hinge variety of the synovial joint. So this all about the bones of the upper limb. Any question? Anything that you don't understand in the bones of the upper limb? Okay, you can enter your roll number.